This for elbow joint mobilization. Type of the joint is synovial, variety hinge joint variety. Articular surface, lower end of the humerus. Articular surface, lower end of the humerus. Here, this suppose this is our lateral condyle, this is our medial epicondyle. So these two epicondyles will be in convex shape. These two epicondyles will be in convex shape. Then head of the radius. Here we will be having head of the radius. Here we will be having head of the radius and upper end of the ulna. Here we will be having upper end of the ulna. So here radius, ulna, upper end, these two shapes will be concave and lower ends of the medial lateral epicondyles will be convex shape. Now arthrokinematics, to get flexion, elbow joint movements we know flexion and extension, flexion and extension. So here to get flexion we need medial gliding, lateral gliding of the humero-ulnar joint and anterior gliding of the radiohumeral joint. This is the point, anterior gliding of the radiohumeral joint, and then extension, medial gliding, lateral gliding of the ulnohumeral joint, and this is the important posterior gliding of the radiohumeral joint, posterior gliding of the radiohumeral joint. So these are the arthrokinematics for the elbow joint movements. Now we will see radiohumeral mobilization. Okay, so for that first we have to give the distraction force to the between radius and humerus. So here we have to first see the radius. So if patient is like this, if elbow is in complete extension, here we can see one depression. In this depression, we can feel the head of the radius and lower end of the humerus. Just we have to keep our thumb and we should do 2-3 times elbow flexion. While doing this, we can feel the movement of the radius over the head of the lower end of the humerus. So after that, so here we understood here head of the humerus is there. So first to give distraction, here we have to hold the radius bone and here we have to stabilize the lower end of the humerus. Then if you give distraction, the distraction force should come exactly here. See, once is the distraction. So okay, how you are giving distraction? This is distraction. So this is the one method. Second method to give distraction, we'll flex the elbow joint and then we'll do pronation. This is the exact stabilization. We can give distraction force here. So this is for distraction. Now we will see mobilization. How to give mobilization? So here first we are going to give the distraction force. First here we are going to give the distraction. Then with our thumb we can give anterior glide. We can give anterior glide. Simply this we can tell posterior anterior glide. Posterior anterior glide we can give. And one more antero-posterior glide we have to do like this. Then here we will be having common extensor muscles. In this common extensor muscles, we have to keep our fingers and you should feel that head of the radius. So we'll keep, then we'll give distraction. After we have to do anterior posterior glide. See, like this, anterior posterior glide. Like this we can give. And to give compression between radius and lower end of the humerus. For that, to give compression, we have to flex the elbow joint like this 90 degree. Then through our thinner and patient thinner, therapist thinner, patient thinner. Then we are going to give the compression. We are going to give compression. It is going to give compression force between head of the radius and lower end of the humerus.
So now we are going to see the ulnar and humeral mobilization. For that, we have to keep elbow joint in the 30 degree or 40 degree flexion. Now we have to catch the ulnar bone. We have to give traction. After we have to perform the glide movement. This will be performed between humerus and ulnar.
How we can give distraction to the ulna? Second method. So for that we have to take the patient shoulder little abduction. Then here I flex the patient elbow. So here I am going to keep my hypothinner over the ulna bone, and here I am stabilizing. Here I am holding ulna. Then we have to give distraction. If you are giving, olecranon process has to move downward. So if we are giving, olecranon process has to move downward. This is the way we can give one more distraction to the ulna. Ulna mobilization. Here first we have to give distraction force to the ulna. Here first we will be having one medial glide and then lateral glide. Medial glide we have to keep our thumb here. Then we should hold the ulna bone. Then medial glide with our thumb fingers behind with our fingers. We have to do medial glide like this. We will give medial glide to the ulna. Lateral glide we'll hold like this. Same again, we'll give distraction, then lateral glide to the ulna will give in this way. That's it.